These major developments, infill developments, will impact health in a very direct way as it increases air quality, but yet they only look at the air quality. So they're not looking at long-term health impacts, and we need to infuse that with health. And the other is how communities are being impacted by infill development. And if CEQA is going to be exempted for these supposedly good infill projects, then how are we going to protect existing residents from gentrification? So these are the community that I've been working with. More than over 80% of the people pay more than half of their annual salaries for rent. These are incredibly vulnerable to market changes and rent increases. So as communities, as you get a transit stop, the community becomes more attractive, and we've seen that in downtown Los Angeles, and it has had devastating impacts on the homeless population, on poor people, and they're moving to areas where their commute times are tripled, and as soon as they can, they buy an old car. So the idea that we have this one goal of reducing vehicle miles traveled, and a great policy idea to, well, let's get people living where they work, is having this unintended consequences of pushing poor people out of neighborhoods that they've been in for 30 and 40 years.